Los Angeles. I'm here to terminate unwanted skin bumps.
This case shows how bad an AKN can get. So it's a cautionary note to those with rashes on the back of the head who will be dismissive about it. It's also a cautionary note to us providers who treat this to understand that it's not just an aesthetic problem. It could lead to a result that looks like this. So often when we see AKN, it comes across as just some bad scarring, mild rash, and that explains the other name for it, which is barber's rash. But as you can see, in this case, it's gone far beyond a barber's rash, and all AKNs have the capacity and the ability to progress to this. This gentleman's case started just like any other AKN. Mild rashes on the hairline after shaving the head, started growing gradually. Initially thought it's something that will go on its own, quickly realized it will not. He went for medical care, saw doctors, saw dermatologists, plastic surgeons, received all the conventional medications that go with this for this kind of thing, injections, antibiotics. Heck, he even had surgery to remove it, and yet it came back. There are certain protocols and there are certain tenets to this procedure that should be observed. And if they are observed properly, the lesion will not return, as we did in this patient successfully. Without much ado, I will let you listen to the patient's word and see for yourself how this situation affected his life and what we eventually ended up doing for him and what the outcome was. I hope at the end of the day, our message would have come across as to how important it is to take this condition seriously and to also go for a decisive treatment with using techniques that actually work. Thank you.
19 years ago, I just had my hair braided, and it was really braided really tight, and I started noticing I had even that same day, I noticed I had little bumps across my hairline across the back. Through all those years, because I would go to skin specialists, I was going to my regular doctor, which had a dermatologist, and they had no answers. So through those 15 years, it was still I was already seeking treatment, but there was nothing. It started right here. Because the little bumps went across my hairline. There was a real small, like hair bumps. And it was just at the very bottom. Once it started to feel like it was infected, it was right here. And this swelled up here, and then it worked its way up and then across. Like all of this was just swollen and full of whatever was in there. But this was a spot that was, they call it, I think, a sinus, where it was like a draining point here and here. So when they wanted to, there was other spots in there that would actually drain, but the most of it was coming here. And so like to relieve the pressure, I would have to squeeze it to get it to drain, just to relieve the pressure, to take away the pain for an hour or so. So it would discharge, I guess it was pus, and then it would bleed too. I've been getting my full nights of sleep and actually resting. It completely changed my life. I was a fitness trainer, and when it got real big, I even stopped working out. I haven't worked out in years. I ended up having to change my profession. So with doing that, I ended up truck driving, which in turn changed my life even more. I was under constant medication, a lot of antibiotics, and I've been misdiagnosed numerous times. So, and I'd even had prior surgery with just before removal, but being on the medication and constantly being in pain, it was changing me. Even my temperament, my lifestyles. I'm really outgoing person. I like to be around people and stuff, but having that is kind of, you end up in a little shell. You stay at home, you don't do the things you normally do. So it affected my relationships with everybody, even my friends. I wouldn't go hang out or go out because of that. So, and then they just went down a list of antibiotics. And it affected everything, because you take antibiotics too long, it start to even affect your bone density and all that, so it's messing with my teeth. They decided I had a little spot on my right side of my neck that they thought they could remove, which they did. And it was okay maybe about a year, and then it just slowly came back even worse. So when it got real bad, I've been doing research looking for specialists. I came across Sandra Lee, also known as the Pimple Popper. She recommended that I come see Dr. Umar. That was like a breath of fresh air, because I knew I wasn't going to have to continue this wild goose chase I'm on looking for help. You have a pimple that's ready to pop and you can't get it to pop. That's what the whole back of my head felt like constantly. I mean, so even with touching, if I sleep, it was hard to sleep. You know, if I roll over in my bed, and you'll wake up like, oh, you know, because of the pain, you know, and it was constantly.
But the sky itself, it's flatter now. It was smooth. It's blending so well with the rest of the neck. So tell me, what about the top? You're applying the treatment I gave you, right?
Yes.
And it's not acting out?
No. It's anything that I feel like it's, you know, I apply a cream to it.
And it goes away.
Yeah.
No discharge from anywhere, right?
No.
No pain.
No.
No swelling, inflammation.
All the swelling that was down here, that's slowly going down.
So you had a sinus there, discharging something there too. You can see that they're all completely quiescent now. They can't.
Right after the procedure, I felt better. I think the wound healed, I think it's 6 weeks. I think it was 6 weeks. Just started back working out, which makes me feel better already, just to be able, because that's what my body is used to. So I'm feeling better, and, you know, just back being able to do whatever I want to do.